Let's now discuss a clinical case of ADHD management in pregnancy. Ms. D is a 34-year-old female with a diagnosis of ADHD who is planning pregnancy and inquires about the safety of continuing Adderall 15 milligrams daily. She wonders whether there are safer options for management of ADHD. What are the questions we would want to ask to guide our risk versus risk discussion? What are the risks of stimulants during pregnancy? And what are the risks of untreated ADHD during pregnancy? So the first thing that we would want to ask and understand in this case is, what is the severity of her symptoms and her functional impairment prior to treatment? Like before she was ever treated with stimulants, or if there have been times in the past where her medications have been stopped for other reasons. If it was a mild inconvenience, that might guide your discussion one way. If it led to severe impairment, where she was having accidents or at risk of losing her job or experiencing major social impairment, that may guide your discussion a different direction. When we look at these risks, most studies are reassuring regarding stimulant exposure during pregnancy without a consistent increased risk of adverse outcomes. There have been many new studies published just in the last few years that have been very reassuring in this regard. There remains a potential association between methylphenidate and cardiac malformations, though this appears to be a very low risk if it exists and is still confounded by other variables. The data here is not strong enough for me to recommend switching from one type of stimulant to another during pregnancy, especially if one regimen has been previously stable. Long-term neurodevelopmental outcomes with amphetamine, dextroamphetamine, and methylphenidate exposures during pregnancy have not shown an association with autism, ADHD, or other neurodevelopmental disorders in children. With that in mind, there are risks of discontinuing ADHD medications, those that we discussed, and also an increased risk for depressive symptoms and more family conflict. To wrap up, here are some key points for this section. Understanding the severity of a patient's untreated ADHD is crucial for an informed discussion about whether to continue stimulants in pregnancy. While there may be a small increased risk of cardiac malformations secondary to methylphenidate exposure in pregnancy that is not observed for amphetamine, dextroamphetamine, these studies are inconclusive. Long-term neurodevelopmental outcomes for children exposed to stimulants in utero are reassuring.